Imagine that your memories are gradually erased, like a pattern on the wet glass, or that your body no longer obeys you. Every movement requires incredible effort. This is not a movie scenario. This is the reality of millions of people suffering from neurodegenerative diseases. Neuro, brain. Degeneration, meaning backward development, meaning atrophy, meaning loss of function. Why is it so important? Because these diseases are an important cause of disability of the elderly. Alzheimer's disease comprises 2/3 of all causes of dementia. There is still no treatment to stop these diseases. In these videos we will talk about neurodegenerative diseases, symptoms, risk factors, how to decrease your risks, what can official medicine offer to treat these diseases, and in the next part we will talk about alternative medicine, what can the patient potentially do to decrease risks or progression of these diseases even more. My name is Dr. Igor Atabekov. Let's get started. Okay, these two pictures are two neurodegenerative diseases. First, amyotrophic lateral sclerosis on the left. What happens? Motor neurons die, muscles weaken and become atrophic. Outcomes, of course, are paralysis, death from respiratory muscle failure after 3 to 5 years after diagnosis. But there are some exceptions, like Stephen Hawking, for example, a famous scientist. He lived for 55 years with ALS. In some cases it can be genetic, hereditary. In most of cases it's not. We don't know the reason why it happens. By the way, there was some connection with mold exposure. If you didn't see my videos on the mold, please watch. Second one on the right is Huntington's disease. This is caused by genetic mutation, and it causes the involuntary movements, chorea, and mental disorders like aggression or dementia, and there is no treatment, only symptomatic suppression. These diseases are less common, but they are catastrophic for patients and their families for sure. Today we will focus on two most neuron killers. These are Alzheimer's disease and Parkinson's disease. Alzheimer's disease. One new case every 3 seconds in the world. Very common. What happens? Memory loss, cognitive function loss, personality disintegration. Parkinson's disease affects up to 1% of people after 60 years of age. It affects substantia nigra. It's a part of the brain that produces dopamine. There is tremor, stiffness, and slowness. Alzheimer's disease is the memory stealer. It's a most common cause of dementia. It's a progressive destruction of brain. You can see here in the left upper corner, it starts from hippocampus. This is the region that is important for memory. That's why it starts with memory loss. And then it affects the cortex, complete loss of cognitive functions. Usually it happens after 65, but it can be in younger ages. In early stage, we can observe forgetfulness, like forgets keys, forgets names or some recent events, difficulty planning, like paying the bills. In the next stage, we can observe the loss in time or place, mood swings, some suspiciousness, like accusation of theft, for example. And in the last stage, inability to recognize relatives, loss of speech or control over body. And it's hard to imagine how hard it is for relatives if their patient doesn't recognize them anymore, or he tries to talk to some relatives that is already dead for many years, thinking that he or she is still alive. What happens in the brain? There is a garbage in neurons. You can see here beta amyloid plaques, sticky proteins that accumulate outside the cells. and tau protein that forms the tangles inside neurons. And you can see the dysfunction and death of these neurons and atrophy. You can observe here the scheme. On the left is normal brain, on the right is atrophic brain, because these nerve tissues are already dead. And Parkinson's disease, it's a prisoner of movement. This is the second most common neurodegenerative disease. The core problem is death of dopamine producing neurons. You can see here the blue dots, and on the left are red and green and yellow, and on the right is very atrophic and small. This is the substantia nigra that produces dopamine. Dopamine is a very important chemical mediator that is needed for signal transduction in neurons. And all this system works to control their movements. And if there is not enough, there is no enough control, and the patient gets involuntary movements, like tremor, like rigidity. It's like stiff, jerky movements, like cogwheel resistance. And bradykinesia, like slowliness, or shuffling steps, masking face, no emotions. There can be also non-motor symptoms, not connecting to movements, often appear years earlier. For example, loss of smell, depression, anxiety, problems with sleep, physically acting out during sleep. And here we also see the pathologic protein accumulation, garbage protein, that is called Lewy bodies or alpha-synuclein. Why I say these complicated names? Because later we'll talk about the treatment. We'll talk about antibodies against this protein. Okay, if we want to talk about prevention, we must know risk factors. Of course, there are some risk factors we cannot affect, for example, age, or family history, genetics. If, for example, you have a relative with Alzheimer's disease, you have 2 to 3 times higher risk of developing it also. I mean, first-degree relative. Gender, also women are at high risk to develop it. But there are also modifiable risk factors. For example, we know that cardiovascular and metabolic conditions like hypertension, like diabetes, obesity, high cholesterol, they can increase risks, perhaps due to vascular problems with blood flow in the brain. Also some lifestyle factors like physical inactivity. For example, we know that exercise boosts brain-derived neuronal factor. They are factors of neuronal growth and that protect from inflammation in the brain. Like, for example, medicinal mushrooms, like hericium mushrooms. They also increase these neural factors in the brain, improving, for example, mood or protecting from oxidative stress. Also, poor diet. High saturated fats or low omega-3 diet, so-called Western diet, are increasing risks. Also, I guess it's due to vascular problems. Also, smoking increases risks by 30 to 50%. Social and cognitive inactivity, low education or social isolation increase risks. Sleep disorders like chronic sleep deprivation or untreated sleep apnea accelerates amyloid garbage protein buildup in brain. And chronic systemic inflammation, some autoimmune diseases, problems with gut microbiome, with this gut-brain axis, or repetitive trauma, for example, in sportsmen. Trauma to brain may also increase risks. Okay, what are the risk factors for Parkinson's disease? Okay, this is, of course, age. After 60, it increases. Genetics, gender. Here, men are more likely than women to develop Parkinson's disease, approximately 1.5 times. Also, there are some modifiable risk factors like pesticides, herbicides, heavy metals, some solvents like trichloroethylene, again diet, again microbiome problems, autoimmune diseases. And what is interesting here, smoking and coffee decrease risks of Parkinson's disease. and that is very interesting. Okay, we understand that we need to get rid of these risk factors as much as possible. What about protective factors? These are factors that will decrease your risks. And of course, it's exercises, because exercises increase hippocampal volume, it increases the neural factors that I told you before. Mediterranean diet, it's rich in antioxidants, it's rich in omega-3, unsaturated fatty acids. Cognitive engagement like bilingualism, you are learning something, some new language, poems, lifelong learning, it's already good, it decreases your risks. For Parkinson's disease, I would not offer you to smoke, because smoking increases risk of Alzheimer's disease and not only this one. But drinking coffee a little bit is not so bad, because caffeine decreases risks of Parkinson's disease by 30%. Okay, what can official medicine offer for Alzheimer's disease? Because in this situation we observe lower levels of acetylcholine, it's another chemical important for signal transduction in neurons. Usually doctors prescribe drugs that will increase this acetylcholine. For example, donepezil, rivastigmine, galantamine, and an NMDA receptor antagonists that will regulate glutamate levels, because glutamate is associated with increased damage to brain tissue. This is memantine, and it's often combined with donepezil. But this is symptomatic treatment. They already developed and studying new methods in order to decrease the progression and in order to even try to reverse this disease. They already have antibodies against this garbage amyloid protein that's called lecanemab, donanemab. But these drugs have quite serious adverse reactions, and they are not super powerful, super effective. And non-drug therapies like Mediterranean diet, cognitive stimulation, but really super effective treatment that will remove the problem was not found yet. Also, this kind of new treatments cost quite a lot. Talking about Parkinson's disease, because the brain loses ability to produce dopamine, the doctors will prescribe levodopa or carbidopa that will transform into dopamine in the brain. It's just a replacement therapy. The problem is after 5 to 10 years, it may cause dyskinesias, involuntary movements. There are some drugs that act like dopamine, for example, pramipexole. This is used for younger patients in order to delay levodopa. And also they use monoamine oxidase B inhibitors like selegiline. Also can mildly improve the symptoms. And of course, if the patient has, for example, hallucinations or depression, they will give the drugs for this. There are some surgical techniques, for example, deep brain stimulation. There are some emerging therapies like anti-alpha-synuclein antibodies against this garbage protein in Parkinson's disease. There is high-intensity trainings, physical trainings. There is physical therapy, speech therapy, but again, we cannot totally and effectively treat this disease. That's why in the next video, let's talk about possible alternative medicines that may, in combination, improve the results of such patients. Thank you for your time, thank you for watching and for sharing this video, and thank you for supporting this channel. I wish you good luck, God bless you, goodbye.
Don't be afraid, Dr. Igor. He's got the cure for what ails your